Okay, hello nurses and future nurses, welcome back to my YouTube channel. And on today's episode of Nurse Clement I am going to teach you on how to tepid sponge a patient. Remember, tepid sponging is a procedure that is being carried out to reduce body temperature, most especially in children or critically ill patients. So sit back and watch this video till the end. Do not forget to like, share and subscribe to my YouTube channel at Nurse Clement and thank you for your support. Thank you for all the comments, the shares, the likes. Thank you very much. I am not taking any of your support for granted. I really appreciate that. And to my beautiful students, thank you for your support. I love you all. So now we are going to look at tepid sponging. And before you tepid sponge any patient, of course you have to set your requirements. And I have my requirement. I have my tepid water in a jowl. I have tepid water, and I have cold drinking water in a glass cup, and I have my 6 flannels here. I have my 6 flannels here, and I have my temperature tray that I'll be taking the patient's temperature as they go along, and I have my bowl that I'll put the water, and I have my old blanket, my bath blanket, and I have my bucket buckets for return water, used water, right? And of course I should have my patient's pajamas or my patient clothing and glove, right? All these requirements are for tepid sponging this patient. So sit back and watch this video. Do not go away. The last aspect of this procedure, the last step, it's very important, right? So sit back. Then before we continue, of course you have to identify this patient. Is this a patient that is running temperature? Is this the patient that is having hyperparexia? So you have to identify this patient, right? So let's go and identify our patient. Good morning, my name is Nurse Clement, and I'm here to tepid sponge your body. Can you please tell me your full name and date of birth? And the patient will tell you his or her full name and date of birth. So now you cross-check either with the patient's handband, or you cross-check with the patient information on the system or on the patient's folder, depending on the one the hospital is using, right? You check. So now that I identify this patient, I have to tell the patient, I have to take informed consent by explaining the procedure. So I am here, your body temperature is very high, and I'm here to make sure that the body temperature drops. So I'm going to use small towels, I call it flannels, to clean your body with water. It's not going to be painful, but I'm going to expose your body a little bit, and I will try as much as possible to maintain privacy. Is that okay? Now, the patient may say yes or no, but for this patient, he says yes. So I'm going to go ahead and wheel my requirements to the patient's bedside, and I'll go and look for an assistant to help me carry out this procedure. So follow me. Let's go and set my requirements. Now that I have called my assistant and my requirement is set, is ready, so I wheel the requirements to the patient's bedside, right? So together with my assistant, we are going to perform hand hygiene and don our gloves. So follow me, let's go and perform hand hygiene. So now that we have, me and my assistant, we have performed a hand hygiene and we have done our gloves, so we go ahead and remove the patient's garments. So please, can you assist me? So during OSCE, make sure that you communicate with your assistant and always direct your assistant on what to do, right? So we remove the patient's clothing. Make sure that you provide privacy to this patient, right? So now ask the patient. Remember, this patient is not unconscious. This patient is conscious, right? So assist the patient, and I drop this inside my laundry bag, and also we remove the patient's trousers this way. Remember, we are trying as much as possible to minimize exposure, right? So now I'm going to use my old blanket to protect the bed clothing, right? Together with my assistant, we put our old blankets, and I will give the patient to my assistant to help me hold this patient. Then I'll place it, making sure that I cover the whole bed sheet. and my assistant gives me back the patient, and she straightens. So while maintaining the privacy of the patient, right? Then I use the bath towel to cover my patient while my assistant assists me to remove the old top sheet that we used to cover the patient's body. So now we are ready to tepid sponge this patient, right? So the first thing now is for me to take the temperature of this patient, right? And I have to wipe from up down, making sure that the thermometer is reading, and I place it on the axilla of the patient while I wait for it to read for a minute. After doing that, I watch for a minute. So it has beeped already for me to check. So I check the body temperature is 39 degrees. So I clean it and I drop. I pick my pen and I record the initial temperature. I ask my patient to sit up or place the patient in a Fowler's position. I ask my assistant to support the patient. I offer my patient cold water. This will help the patient to the temperature to come down. As the patient drinks the water, the heat inside the body will evaporate. Give the patient cold water to drink. So as the patient drinks, it helps to reduce the body temperature, right? So after which the patients lie down, and then the first we pour our tepid water inside a bowl. Then I pick the first flannel. Remember, you're not going to use cold water. It should be a slightly warm water, tap water, tepid water that you are going to use, but not cold water, right? So that it will open as you tepid sponge, it opens the hair pore of the patient, and then there will be the heat in the patient's body will evaporate, so that it letting the heat go out of the patient body, and thereby reducing the temperature of the patient's body. So the first one I'm going to do, remember not to squeeze the whole water this way. So when you are squeezing the flannel, make sure that you have a little water, you see, like this. As you press, there is water in the flannel. Then you place the forehead of the patient, right? That's the first place you place it. Then the next flannel, remember I told you earlier that we have 6 flannels, right? Then the second one, you use it to clean the trunk and the upper limbs, right? So I cleaned the trunk of the patient, making sure there is water on the patient's body. This will help to cool off the temperature of the patient. Just as you can see, there is water on the body of the patient, right? So do not squeeze the water on the flannel completely like this. So you have to. Then you give your assistant the flannel to clean the hand that is proximal to her, right? Now, and I dip the flannel again back in the water, and I clean the hand that is what? Proximal to me. Remember, I've given my assistant the first time to clean the hand that is distal to me. So this one is proximal to me. Making sure that you leave some water on the patient's skin this way, right? As you can see. So thereby assisting making allowing conduction to occur, right? So now that we are done with the upper limbs, and I will ask my assistant again, I will do this again, and I will ask my assistant to hold the patient for me towards her side. Yes. towards her side, to also clean back the back of the patient, right? Also leaving water, right? So after letting it for some seconds, we bring the patient down to the normal position, right? So we place another flannel on the patient's armpits. Remember, these are areas that heat easily goes out, right? Place another flannel again on the, ask my assistant to assist me, place it on the axilla that is distal to me. Then we expose the lower limbs together with my assistant. We expose the lower limb, and I squeeze the water, the water from the flannel, and I give my assistant to clean the leg that is distal to me, making sure that you leave a remnant of water on the patient's skin to aid in conduction. So, and I squeeze the water again, the flannel again, and I do the leg that is proximal to me, right? So the next thing is for me, if the patient, in case you want to give perennial care, you give the patient another flannel to clean, but if the patient cannot clean, you clean it yourself, right? So the next flannel is for me now to put on the patient's groin, right? The patient groin, make sure that you provide privacy, and also you put the next flannel also on the groin that is distal to me, right? Letting the patient, this time around, be mindful so that we will not cover the patient. Remember, we want to achieve reduction of temperature, right? So we'll be mindful of that. So we assume that the one on the head is already warm. What we'll do is that we'll remove this one and then replace it. Make sure you rinse it. It gets cold. You rinse it and you change the water. Remember, I told you earlier, I have a bucket that will be changing my water, and I pour this water. I assume that the water is a bit warm and dirty, so I make another fresh water. So now I squeeze the flannel, making sure that there are remnants of water on the flannel, and I place it also on the patient's forehead, leaving it there. So I assume this one is warm also, and I change it again. I dip it inside water, right? And I squeeze it and I place it back on the axilla, right? Not squeezing all the water completely. And I make sure that I sponge the trunk again and the abdomen, right? Leaving some water on the body of the patient. And then I provide a little privacy. So now that we are done with this step, right? So I'm going to stay for like 5 to 10 minutes to see whether we have achieved the reduction of this patient's body temperature. So now we assume that we have reached 10 minutes and I have to check the patient's body temperature now. So, and I on it and I remove this flannel and I put the thermometer under the patient's axilla, right? And I allow it to read. So now I assume that it's 1 minute already and I remove the thermometer. As you can hear, it's beeping because it's ready, right? So I checked. Oh, now the patient's body temperature is 38. When you achieve like 1 drop of degree centigrade, it's said to be satisfactory. So now that we have achieved 1 degree centigrade, that means we have properly done the tepisponging of this patient. So again, remember, if you repeat this stage, this next the step, or if you did not achieve reduction of body temperature, the next thing is for you again to continue tepisponging, right? You squeeze the water and tepisponge the patient again, right? You tepisponge the patient and then also keep this one at the axilla. So you keep repeating doing this, and in case you did not achieve the body temperature did not drop, you administer medication like paracetamol, right, or diclofenac. Paracetamol is preferably paracetamol injection or orally, depending on the condition of the patient though. So now, as I have documented that the patient temperature has dropped 1 degree centigrade, so I assume we are done, and we did the second one, right? And I removed all the flannels. I take the body temperature again. Remember, I've done another tepisponging. I place also this thermometer at the patient axilla to take the temperature of the patient. Again, I record, right? I record it, I pen it down, and I record. And this time around, I've gotten 37.5. So at least we have achieved the desired results. So now it is time for me now to dress my patient's back. So remember, I have my patient's gown that I have to put on to the patient. Or if you feel that the clothing that you've removed from the patient is not dirty, you can replace it back. Together with my assistant, we put on the patient's clothing. My assistant assists me to put the patient's clothing, making sure that we maintain privacy. So, and then I bring up the patient's top, shirt, and my assistant helped me to lift the patient up, let the patient sit down, and then I put on the patient's clothing. And my assistant helped me to put the hand that is distal to me, move the towel with the bath towel. And I asked my assistant to assist me. I'll turn the patient so that I can remove the old blanket that I used to protect the patient's bottom sheets. And my assistant also assists me to remove it. And I place it inside the laundry bag. And I pick the blanket, the top sheet, and cover my patient. This time around, I'm not going to cover the patient completely. Remember, we are trying to achieve reduction of body temperature, right? So we cover the lower limbs of the patient, and we allow a little bit of exposure of the patient's body, right? And this time around, we on the fans to allow the patient's body to aid conduction faster, right? So now we are done with this procedure, and I will pick my recording sheet or input in the system, that's computer, that tepisponging done, and the body temperature of the patient presently is what, 37.5. You pen it down, you record, and you are done with this procedure. The next step is for us now for me to discard used equipment. I rearrange this used equipment. So I discard used equipment by rearranging. Okay. So now the next thing is for me to remove my glove and perform hand hygiene, right? So I remove my glove together with my assistants. We go and perform hand hygiene. Now that I've removed my glove and I perform hand hygiene, right? So I record the procedure. The patient's temperature reduced to 37.5 degrees centigrade. I have come to the end of this procedure. Thank you for staying with me. Thank you for staying with me till the end of this procedure. Do not forget to like, share, and subscribe to my YouTube channel. And in case you want me to perform any procedure and upload on my YouTube channel, please let me know. And do not forget to join my community. Very important. Do not forget to join it. I love you all. Bye.